All right, we're recording. So thank you and welcome to tonight's webinar for the Active Aging Consortium Asia Pacific. I would like to turn it over to Mala.
Thank you, Catherine. Greetings to all for a happy, healthy, and blessed 2022. Welcome to this webinar in the start of the year on a very important and essential topic, empowerment of older persons. All governments and organizations are doing various programs on this theme, and we are pleased to bring focus on this. As you are aware, this event is organized by ACAP, Active Aging Consortium, Asia Pacific. As the governing body member of ACAP, I'm very glad to have partnership with the president of ACAP, Catherine Braun, and other members too, many who have joined. So on behalf of my NGO Development, Welfare and Research Foundation, I'm with ACAP to bring this webinar to you. Thanks for joining in from various parts of the world. We know as the webinar will progress, many more will be joining in. I request all to keep themselves muted until question and answer session, if only they have a question, and speakers to, of course, unmute themselves. I'm the managing trustee and founding member of DOF, that is Development, Welfare and Research Foundation. And now I invite Kiran Puri, also founding member with me and currently honorary director of DOF, to take forward this webinar as the moderator. Kiran, over to you.
Thank you, Mala. I, Kiran Puri, Director, Development, Welfare Research Foundation, take this opportunity to greet all the contributors and participants from the various parts of the world who have joined this prestigious webinar on empowerment of older persons conducted by Development Welfare Research Foundation in collaboration with Active Aging Consortium Asia Pacific. Due to demographic changes, there have been unprecedented transformation in the increase of older population above the age of 60 years. This phenomenon is going to intensify in the coming years. Population aging will have profound implications on many facets of human life. An aging population will affect everything, right from individuals, economies, communities, labor markets, national and international life. To add to things, these demographic changes would also pose unique challenges to every society in the form of complex health and social challenges to which countries must rapidly adopt, both in the present and in the future. Rigorous, innovative, and multidisciplinary changes need to be brought about. One example of such a change is empowering the old to take care of themselves for the maximum years of their lives so that they can remain independent and lead a dignified life. Empowerment needs to be carried on in all fields of life, right from education to health and finances. Today, in this webinar, we have experts who are going to share their expertise of the ways various countries are empowering the older persons by leading and teaching them about their health needs, how they can take care of their finances, which will help them to remain independent and lead a comfortable life. Emphasis would also be laid on the significance of intergenerational bonding, which would earn them the required respect. With these words, now I would like to request Catherine L. Brown, President, ACAP, to deliver her welcome address. Over to you, Catherine.
Well, thank you. Thank you very much. I would just like to express my fabulous, let's see, am I sharing my screen?
Yeah, yeah.
Yes, yes.
Oh, there we go. Okay, I would just like to express my gratitude to Kieran and Amala for helping put this together. They've just done a fabulous job at, to bring us an exciting evening, well, evening for me, an exciting webinar on empowerment of the older person. And I am just thrilled that we have such fabulous speakers from Singapore, from Nepal, from Sri Lanka, from Pakistan, and from India. I'd just like to say a little bit about ACAP, the Active Aging Consortium Asia Pacific. And that is that we are a group of friends, friendly gerontologists who come together to share friendship and to share best practices for active aging in the region. We like to learn from each other. We have a bi-monthly bulletin. We have a monthly webinar, and everything about us is free. So because you've signed up for this webinar, I will be adding you to the mailing list. If you get too many emails from us, you can always get yourself off, but we really would like to just extend our network as far as we can with friendly gerontologists. With our bulletin, you can see a sample here. We feature stories by you and photos from you, and our next deadline is, oops, not November 15th, sorry, but January 20. So we would certainly welcome stories from you. We also have webinars, and these are some of the topics that we plan for 2022. They're usually an hour, although today is an hour and a half. And if you have ideas for speakers or moderators or topics, please send them to us. I'm introducing you to Taryn Tanji, who's my assistant with this project. And she couldn't come tonight because she's studying for an exam, but there's her photo. So you'll meet her soon. Just again to say that we have members from mostly the region, this region, and I'm going to add Pakistan and Sri Lanka and Mauritius on here to my map, because we have now new friendly gerontologists coming from these countries to this webinar. And you can always email Taryn or me for more information about our group. So just again, I am so happy to share these faces of the wonderful speakers that Kieran and Mala have organized for tonight for the topic about empowerment of older adults. So thank you so much, and I am giving it back to Kieran.
Thank you,
Okay.
Catherine.
Okay, before Kiran, I'm going to just budge in. Thank you, Catherine, for your warm, welcoming words, and really appreciate your support. So now, briefly, I want to say that Kiran is going to switch her role as a moderator to be a panelist. And I take this opportunity of inviting Kiran Puri to make a presentation on why is it necessary to empower older persons. I take pleasure in introducing her, and she's going to set the grounds for our discussions today. Kiran Puri is a historian with specialization in cultural studies and aging issues. She has diploma in the income security of the elderly from International Institute on Aging in Malta. She has been working on aging concerns related to women empowerment aspects, programs and policies for the well-being of older persons for the last 20 years. She has been involved with the Indian NGO Development Welfare Research Foundation since its inception, and has been working in the interest of older people and advocating for their rights. She has been involved with conducting adult education programs, has published articles on aging in books and journals, has presented papers in conferences, seminars, and organized discussion meetings to take forward measures for the welfare of older persons. I'm happy to have her support for the NGO Development, Welfare and Research Foundation. And together, Catherine, we would like to say that we would take forward many of the goals and aspirations of ACAP to make a wider impact in the world. Over to Kiran Puri for her presentation.
Thank you, Mala, for those nice words. And today my presentation is about why is it necessary to empower older persons in India. I'm going to talk about India, but that is also applicable for many of the Asian countries. So with the increasing number of elderly every year, there are a lot of challenges faced by countries like India, which are still in the developing stage. Longevity is bringing with it numerous concerns and challenges. The traditional norms and values of Indian society laid stress on showing respect and providing care for the aged. However, in recent times, society is witnessing a gradual but definite decline of the joint family system, as a result of which large number of parents are being neglected by their families, exposing them to lack of emotional, physical, and financial support. There are cases of occurrences of emotional, psychological, and financial abuse, neglect, and abandonment of elders. This clearly indicates that aging needs to be addressed very seriously. It has become imperative to empower and educate the elderly from an early age so that they can look after themselves for as long as they live and for the maximum years of their lives. Active aging, management, and controlling of one's social setting is been ignored from there, and and controlling of one's social setting is essential basis for physical and psychological well-being. Apart from this, some other facts which cannot be ignored are the increasing proportion of older women and more widows than widowers. This prospect requires a better understanding of the implications and possibilities posed by population aging, as well as the situation of older persons themselves. When people live longer, they need more care and also income security to lead a dignified life. In this type of scenario, it has become imperative to have policies to ensure healthy lives and promote well-being of the elderly, to safeguard them from abuse and neglect, to conduct programs and workshops to empower them, to keep their minds and alert and engaged so that they learn daily and pick up an additional degree certificate to further enhance their caliber and potential soon after retirement, so that they can look after themselves. The old should be able to develop the potential of dealing with untoward situations and circumstances which might crop up in their old age. To meet these challenges, the government of India and many NGOs have been convinced to start adult education, professional training, and personalized learning programs for seniors on dementia, computers, smartphones, and digital literacy, hobbies like art, craft, dance, music, courses on learning languages like English, German, French, Spanish, and Japanese have to be encouraged. Learning these languages would not only provide earning opportunities if a person is interested. There is a dearth of people who know foreign languages, and these skills can be utilized in many ways. Teaching English to foreigners online, working as translators, etc., are some of the options that can be explored. By learning digital literacy, they would be able to handle their finances, conduct online banking transactions, take care of their investments, and also be in touch with their friends and relatives on WhatsApp and other apps of communication. A central sector scheme to improve the quality of life of the senior citizens was revised on 1/4/2018 by the government of India. Special attention is being given by the government in providing basic housing and homestead to BPL, below poverty line households in rural areas, providing social assistance to the elderly, widow and disabled persons, providing urban amenities in rural areas for improvement of quality of rural life, capacity development and training and rural development functionaries for letting the older persons, especially the women folk, to know of their rights, especially to property, protection against abuse, exploitation, and gender disparities. Programs and workshops on nutrition and awareness on elder healthcare need to be given a priority. Over the years, government has launched various schemes with the intention of providing healthcare. Ayushman Bharat is a universal health insurance scheme of the Ministry of Health and Family Welfare, Government of India. PMJ was launched to provide free healthcare services to more than 40% population of the country. In this scheme, the elderly of the poor families are also covered. The scheme offers a health cover of rupees 5 lakhs. A special department for the care of the elderly has been set in All India Medical Institute of Delhi. Health charts stating proper nutrition and exercise should be prepared and circulated in villages and habitats of towns so that people can delay the onset of old age diseases. The skills development and professional classes should be continuously updated with new options of re-employment and earning money, and thus helping the older persons to be economically independent. Thus, upgrading the knowledge of the older persons would enable them to be in tune with modern devices and upcoming technology. It would help them in fostering respect for themselves, gaining confidence in their potential, adding happiness, satisfaction, and contentment to their lives. Thus, empowerment is a must and would definitely lead to the reduction of dependence and chances of older persons becoming victims of neglect and abuse in old age. It would definitely help in adding life to years and not just years to life. Development Welfare Research Foundation has been continuously striving for this empowerment and will continue working in this direction also in the coming years. Thank you so much for listening ardently. Yes. And
Thank you, Kiran. Thanks for setting the platform for today's interactions and throwing light on measures being taken by the Indian government. Some of these are common to many of the Asian countries who are progressing ahead with many of the steps which empower older people. So I'm going to now turn over the stage to Kiran to move on as being the moderator and conduct the following program.
Thank you, Mala. Thanks a lot. Now I would like to introduce Dr. Wei Chong, who is going to speak on senior empowerment during the pandemic. Dr. Wei Chong is the founder and CEO of NWC Longevity Practice, a social enterprise established in June 2020 that aims to create a world where people of all ages thrive by means of community development, capacity building, consultancy, and clinical services. Dr. Chong has been a practicing community aged care physician for over 20 years. His clinical and research interests include primary health care for the frail, elder abuse, dementia care, case management, sustainable community aged care system, end-of-life care, and comprehensive needs assessment. Dr. Chong was awarded the Healthcare Community Award by the Courage Fund National Healthcare Group in 2016 for his role in community aged care. He was given the Minister of Health Award in 2018 by the Ministry of Health, Singapore, for his contribution as a member of the work group of the Care Shield Life, the long-term care insurance system in Singapore, and more recently, the Community Care Supertasking Hero Award in 2021 by the Agency of Integrated Care, Singapore, for being in more than 20 work groups and working committees that helped in the development of aged care system in Singapore. Dr. Chong is also Singapore's Inter Fellow. Now, Dr. Chong was the former Chief of Clinical Affairs of SU Foundation and is still holding a part-time position as the foundation's clinical program consultant, as well as research fellow, International Longevity Center, Singapore. Now, I would forward the floor to Dr. Chong for his presentation.
Thank you, Kiran, for the very kind and elaborate introduction. I'm very happy to see many old friends. So I was from South Foundation, Chief Clinical Affairs. I Thelma, my fellow countrymen. I remember Dom, Professor Tribudi from our work in HealthPage and Indonesia ADB project, and Dr. Shiromi from Sri Lanka. I'm so happy to see all of you. And of course, Professor Mala Kapoor, we worked together on a book on elder abuse a few years ago. So let me share my screen. And then it's a very short presentation, but why I want to talk about empowerment during pandemic, because as a doctor during this pandemic, I noticed its tremendous impact, particularly on the older generation. As a doctor, I work in a nursing home, I do home care, I work in a seniors clinic. So at the beginning of the pandemic, I have a lot of seniors coming to me with poor sleep and very sort of subclinical anxiety issues, and many of them because of their old age, and everybody says that the pandemic is more dangerous for older people, and so they were discouraged from going out, and so the social isolation issue was worse. And when we operate a day center, the pandemic really had a huge impact on those people, frail elders attending day center. And in nursing homes, many of them could not meet their family members for months. And in home care, and we do take care of people who are dying. And when they are diagnosed with COVID, there's no way they can palliate in the community, so they have to be admitted to facilities. And when they die in the hospitals, the stories I heard from my friends in the hospitals were quite sad. It's very lonely deaths, you know. So I think pandemic sort of we bring a focus. I mean, everybody is focused on this pandemic, but the plight of the seniors is particularly sad to me. So I'm going to share with everybody a piece of research that I participated in with Lien Foundation just earlier in the beginning of the pandemic, and then we'll just talk about the opportunities and the actions that we've taken in Singapore, and also some of the organizations that I'm associated with, what we are doing. So this is the latest. This morning I obtained from Google, from Johns Hopkins Center. So currently we are experiencing, like the rest of the world, the Omicron surge at the beginning of the year. So you can see around October, November, December, that's the Delta wave that we sort of overcome it. And from the beginning, the first case in Singapore started in January 2020, and then we went into heightened alert, and then there was a series of what we call the circuit breaker. It's a Singapore version of our lockdowns, and then of course it became quite well controlled gradually because of the very severe measure in social distancing, testing, and quarantine practices, and thankfully the vaccinations happened, and Singapore had quite a high rate of vaccination, and it was quite rosy until the Delta wave hit, and then we have a few months of repeated cycles of heightened alert. There was like open and close, open and close. You know, it's the usual situation that you see everywhere, that everyone in the world is trying to come to terms to understand this particular virus even as they mutate. And then subsequently we have a stabilization phase, and now we're in a phase where we're transiting to allow um, endemicity, where we sort of try to live alongside with the pandemic, because we have a high rate of vaccination. So currently all the eligible age groups are more than 90% vaccinated. So you can see it's quite uniform across the age group. And the people in the 80s is slightly lower. And from knowledge of a doctor working in long-term care, there are many seniors who are like near the end stages of their lives. They would decline vaccination. The family would also sometimes wonder whether they should be vaccinated, but still we have got more than 90% vaccinated. And this is the current stats, and you can see the death rate. Those who are vaccinated, if you're in your 80s or and plus, so it's about 3% chance of dying if you catch COVID. But if you're not vaccinated in Singapore, and if you're in your 80s, your chance of passing away is nearly 1 in 4. Yeah. And currently the healthcare system is fairly all right. We still have got capacity at the moment, but we are preparing ourselves for the Omicron wave. So the threat of this pandemic towards senior is of course we know is not in the favor of the older persons. And also in Singapore we have a relatively aged population. 1 in 6 of us are above the age of 65, and 10% has dementia above the age of 60. And so we have got huge number of seniors with disabilities, cognitive impairment, and so on. So you would have to consider the need for long-term care and the impact of pandemic on long-term care. So that is a big issue. And in Singapore, still many seniors are taken care of at home, and the family themselves are also impacted, and many of are at risk of not coping well. And we know that Singapore being like a hub city within Southeast Asia, we attract foreign migrant workers, particularly as foreign domestic workers. But this runs the risk of policy changes, perhaps in border control, perhaps the migration of workforce across countries. And supporting disabled seniors are particularly challenging during this time. So I'd like to just share with you something that I did with Lian Foundation Oliver Wyman earlier on in the pandemic in 2020. So it was a point of view research, doing in-depth interviews with many nursing homes, many experts, home care operators, daycare operators, local and international experts on the challenges we face and the opportunities and some of the measures that we did to circumvent the impact of the pandemic on long-term care, the frail seniors. So the main findings I've just summarized in just 3 slides. In nursing homes were particularly affected because the care was disrupted, and then there was a lot of the space became too crowded because of pandemic. It became too crowded, and the workforce became very short, because if a worker is diagnosed with COVID, they have to be quarantined, and then many of the colleagues will also be quarantined. So it was quite bad, and many of them, and until recently, our workforce in nursing homes are manned by workers from the surrounding countries. They couldn't go home for many months, and there was no visitation, so there was a lot of social isolation. The center-based care, the daycare centers, were not any better. Because of the pandemic, many of the daycare centers had to close down, and the seniors staying at home for a few months, they become really disabled. The dementia get worse, and when we reopened the daycare center, many couldn't come back anymore. Some of them even passed away because there is no interactions. For home care experienced a boom time during the pandemic. So there was increased demand for home care, and the problem was then the financing and resourcing of the home care manpower. and there was a lot of confusion. Some clients were seen by many home care services because there was lack of coordination. So there was like a sudden explosion of demand for home care. And during this period, there were also a lot of innovation. So we find that, I think you can see it in many parts of the world as well, that many of the daycare center and home care started to go into more digital led model. Previously, they were trying to do it, but there was a lot of inertia to changes. But because of the pandemic, it was very fast. Everybody was online, on Zoom, doing exercises, and there was a heightened awareness of preventive health. So there was a lot of exercises carried out online, and there are a lot of YouTube videos being shared about exercises, and there was more home care. And then there were smart utilization of space by redesigning some of the daycare center and the nursing home, so that there is no cross interface of staff and seniors. And manpower, there was also a rethink of the need to upskill to be more digitally savvy. So a case manager now will need to prescribe technology, and then you need to be really cross-trained. And there was also a rethink about how we cannot depend on migrant workforce for our long-term care labor force. And because everybody realized the impact of the pandemic on mental health, the senior well-being, the mental health was in the limelight. So now it became an important curriculum in schools, that there are a lot of mindfulness classes now in schools. And then in seniors, there are many classes supported by our Council for Third Age related to mental well-being. So for example, there's one called Riding the Waves of Change Smiling. So it's quite well subscribed. So there's a lot of mental well-being activities now. And caregivers, there's also a renewed effort to support caregivers, particularly during this pandemic. So these are just some examples. This is a class on mindfulness for healthy aging. I was running it together with a colleague, Dr. Chu, so two of us. He's a MBSR trained physician. Then there are Older Persons Association, which is because of IP issues, so I'm using only my material. So I'm the vice president of Happy Village, which is like a retirement community. We wanted to build a retirement village, but the pandemic sort of make us change our thinking. So everything is online now. We're doing qigong every week, and then we will do mindfulness practice, and then we will chit chat. We used to just gather and then eat and have a snack and do qigong and do practices, but now we're online. So because of the pandemic, there was also another rethink about how we're going to build our retirement community. It's no longer a physical one. It's more like influencing the neighborhood to become more age and dementia inclusive. More use of technology, IoT. There are many pockets of successes in Singapore as well. The Shine Seniors project, the care line from Changi General Hospital, where you can have sensors in the house to detect movement patterns. And then well, this is a suggestions from Lin Foundation's research, that the void deck in our public housing, there's a ground floor usually is empty. We can make them become day center without actually building day center. And then perhaps because of the pandemic and the influence on our human transport, the concept of hub services become more important, and there are already experiment in our Kampong Admiralty, in Komsa at Whampoa, and in many other places, where you have got by use of telehealth, day center, primary care clinics can work closely together to support seniors living in their own housing estate. So so in a way, we bring long-term care closer to home, where you can avoid institutionalization. So it's not fully mature yet, but there are pockets of redevelopment everywhere. So yeah, so yeah, I can't see the line is blocked, but anyway, you get the picture. So long-term care is likely to have to be rethought, and our Happy Village retirement village is also undergoing a transformation to become online. So that's my very short presentation. Thank you for your attention. Thanks.
Thank you, Dr. Chong, for giving an enlightened view of the how Singapore dealt with the pandemic and how NWC contributed to it, how things became digitalized, and how home care became the solution to many of the problems led during the pandemic. So thank you for sharing your videos and about how exercises were helping during the pandemic. We do appreciate your taking your time off and making this lovely presentation. Thank you, Dr. Chong. And with this now, our next speaker is going to be Dr. Sanju Thapa Magar, who is going to speak about empowering older persons through literacy in Nepal. Sanju Thapa is the Chief Executive Officer of Aging Nepal. She has been working in the field of aging population for 7 years. She looks after the overall activities of Aging Nepal, particularly research, training, advocacy, and campaigning. She is also a member of the steering group of Global Alliance for the Rights of Older Persons, GARUP. She has a master's in sociology. Now, I would request and pass on the floor to Sanju Thapa Magar.
Wonderful introduction.
Yes.
Thank you, Kiran. Thank you for this wonderful introduction, and thank you, Dr. Chong, for so motivated and influential presentation. First, I would like to give my thank to Miss Kiran, Dr. Mala, Catherine for this opportunity. Today, I'm going to present a paper on our success story of empowering older person through literacy in Nepal. Before going to the slide, I want to give a brief introduction why we started literacy in Nepal, and this is the first literacy program for focusing older people in Nepal. As we know, the majority of older people are illiterate, particularly in developing countries like Nepal, and the illiteracy is more in older women due to the social taboos on girls' education and limited academic institution during 1960s. This bunch of illiterate youth, especially girls of 1960s and older people of today, is struggling to live a normal life in present-day society. In Nepal, more than 90% of older women are illiterate, according to the census 1952. Illiteracy empowers all, including the older people. Without literacy, it is extremely difficult for an older person to meaningfully participate in socio-political and economic aspect of the society. Moreover, illiteracy in old age adds more challenges for older people, especially for those who are living in urban areas in their later life, because it is worth noting that the world is going through a trend of fast urbanization, and rural life literacy is taken for granted, and without it, older people become dependent on others, even for small activities which they could do by themselves if literate, like using TV remote, making phone calls, visiting doctors, traveling in public vehicles, crossing the road, shopping, and so on. They have to be dependent on their family member who are already under time pressure and may not be willing or able to help. So this is why we started our literacy class in Kathmandu, the capital city of Nepal. Okay, let's move on to slide. This is a group of our new literates from Kapan. We piloted the project with support from NGO Committee on Aging in 2016. Actually, they call for proposal, including other countries like Togo, Mali, and Mozambique. Luckily, Aging Nepal from Nepal selected for the project, and we run 6-month pilot project for the first time in Nepal. Okay. For the implementation of the project, we selected the area from nearby Kathmandu Valley or Kathmandu district, Kathmandu. The area was Buranilkantha municipality, ward number 10, because there was higher migration rate and the area is rapidly urbanizing. So we can find lots of older people who came from rural area to live their later life with their son and daughter who have already settled down. Okay, and we selected Sri Ashtabhuja Samaj as a local organization to implement the project because they have good rapport with the older people of the area. So this is how we selected learners and teachers for the class. For learner selection, we visited their home and registered their name. We also received took consent from their family members and convinced older people to for the class. And this is very challenging job for us because they don't want to do anything because they have done they think that they are waiting for their death. So it's really sad story. So for teacher we selected 2 teachers from the area because the local people can build a good rapport with older people easily, as well as the project will be more sustainable. So we selected 2 teachers from the same area. And this is the class. This is our class where we piloted the project. You can see the happy older woman. And from home visit, we selected 30 older people, 28 older women and 2 older men, because the number of older women is high in that area. And we found that the most of older men can write their name and they can at least read Nepali sentences. So we give more priority to older women. 78 was the oldest learner of our class. Earlier, we planned to conduct 4-hour classes per day, but we found that majority of the older women have to do household chores and they have to take care of their grandchildren. So they requested to reduce the class, and we practice only 2.5 hours per day. And this is our successes of the class. We found that the class helped to fight loneliness and elder abuse. The older woman who left alone at home after their children and grandchildren left home for schools and jobs, they have to live alone, helpless. Likewise, our class also enhances their self-respect, self-care, and confidence to raise voice in family and community, because our class give them life. Our class help them to learn English, Nepali, as well as the home appliances, and we also teach them to use mobile phone. We found that the class also create bond among the new learners. The older women or older people who left alone at home, they have a group of, now they have the group of the same age where they can share their sorrows, pain, happiness, and everything. Similarly, we also help them to learn how to use mobile phone, how to make phone calls, and how to use basic home appliances. So it helps to access them in new technology. And generally, people think that older people cannot learn new things. They have very low memory capacity. They cannot do anything. They are dependent. But our class break that social misconception. So this is also one of the successes of our class. Likewise, we created that new literates group as a social resources that can be mobilized for societal development. We also mobilize them in so many projects, like we give them seed fund to run a project on biodiversity conservation, and that they did really great work. They conserve their biodiversity of their local area, and they also conserve their public places. So they are also the new social resource of the community. And by this project, we also developed a book in Devanagari script, considering the cognitive status of older person under guidance of Professor Helen Abadji. And this is the first book in Devanagari script for older person. After the successful completion of this pilot project, we replicate the same project in 7 different areas, and those projects are continuing by the local government, local organization, with support from the local government and by the local organization. And some of the classes are still running before the pandemic situation, and some are also still running after this situation also. Okay, here are some other issues of our project. We also made aware on different issues of their rights, health, financial aspect. We usually invited expert from different issues, and they give orientation on the rights of their health, financial aspect, and so on. We also mobilize them in advocacy and campaigning on different international days of importance, like International Day for Older Person, World Health Day, and so on. During the class, we also conducted health camps. We engaged them in games, and we also took them for day out for refreshment. And during that day out, we asked them to use their theoretical knowledge in practical field. Like, we asked them to read signboard, we asked them to make phone call to their family members, we asked them to cross the road, and so on. So here is the case study of Kanchi Gautam, and I have just put the statement of Kanchi Gautam. Kanchi Gautam was 69 years old back then, and she said that bank refused to provide loan because I was unable to write my name. Sorry, here is mistake. My name. Now I can write my name and sign. The class has made my life much easier. I'm very happy. So this is the statement of Kanchi Gautam. And another one is Dhanamaya Khatiora, 71 years old. Dhanamaya is living with her grandchildren to support them in household chores. And she said that we have a phone at home, but I generally had to wait for some grandchild to come from school and dial the phone number for me. I could not go for shopping alone because I neither could read signboards or labels on the goods nor understand the math they do. I was so dependent on my grandchildren. Sometimes I wondered if I were supporting them or just being burdened to them. So she is from rural area, and she's living with her grandchildren to support them. And the grandchildren go school and colleges for their study. And this is the case of Dhanamaya Khatiora. After the implementation of our class, after 6 months of implementation of our pilot project, we conducted a small survey to measure the success, and we found that that class changes in behaviors of family. Their family members started to include them in family discussion, and their grandchildren started to do their homework even in their presence. So their concerns about their needs like medicine, clothes. Similarly, the behavior of neighbor is also changed. Like, they started more welcoming in casual talk. They have now more friends. Their neighbors start respect them, and so on. And that group of neo-literate can also take leadership in a group and in other projects also, because now they can read and write, and they are empowered through the basic literacy class. I have already mentioned you about the background of our project, because we started the project because more than 95% of older women of today is illiterate. Literacy among girl child is still low in Nepal. And lifelong program, there isn't any program targeting the basically literacy, lifelong learning to older people. So started this project in 2016. So we faced major two obstacles while implementing the class. First one is there is a deep-rooted traditional belief that older people cannot and need not learn. So we face challenge to convince the older people also, because they don't want to go anywhere. They are very passive, and they think that they cannot do anything. So we energize them, and we make them we convince them that that literacy is very important for them. And another problem is funding support. It's really hard to get fund for literacy for older person, though we can get fund for the child education and your youth education, but it's really hard to get fund for the education of older people. And how we overcome by that obstacle, we made aware through different sessions. We mobilized radio, we published article, we invited TV, television to cover the news and so on. We also influence our government to make it intrinsic part of our national education system. And we have a future plan for the literacy class. We are planning to conduct one class in each 7 provinces of Nepal, and one class has already started in Kathmandu, in Lalitpur district. Similarly, we have also planned to conduct digital literacy for basic literate older people, and we are planning for this. Okay, thank you.
Oh, that is a very nice presentation, Sanju, all about the advantages of literacy and how it helps in social and political participation, especially of the rural people, and how literacy helps to empower people and to carry on with their day-to-day activities. Your pilot project of 2016 is excellent, and how you got teachers and how you overcame obstacles, and what are your future plans. Thank you so much, Sanju, for the presentation. Thanks a lot.
Opportunity. If you have any queries, any clarification and confusion, you can ask me, or you can write in our official email address also. Thank you.
Yes, people will put their questions in the chat, and we will take questions after the presentations are over. Everybody will, all the contributors will have to answer the questions which they have put in the chat after the presentations. We have time for that. Thank you so much, Sanju. And with that, I would request Chiromi Mudwe Gay to speak on empowering the old with the benefits of intergenerational bonding. Chiromi is a specialist medical doctor in public health community medicine with extensive work experience on elderly and disability care programs related to planning, implementation, monitoring, and evaluation at national and international level. She is the National Program Manager in Elderly Healthcare in Sri Lanka, a researcher with skills in conducting elderly care research, trainer and a lecturer in medical, undergraduate and postgraduate teaching. She has work experience in partnership with United Nations, funding agencies, WHO, World Bank, and non-governmental organizations. She has work experience at the Public Health Department, National Health Services, Somerset, United Kingdoms. So with that, I pass on the floor to Chiromi for her presentation.
Thank you very much for your kind introduction, Kiran. And also good morning, good afternoon, good evening, where you are in the world. And especially I would take this opportunity to say thank you to all the organizations and organizations everywhere. And also special thank to ACAP and Catherine, Mala and Kiran. And with that opening remarks, I would like to share my views on empowering the old with benefits of integration bonding, intergenerational bonding. So with that word, actually, we would like to see before coming to the Sri Lankan aspects and all those things, I would like to share what is my outline of the presentation, importance of our intergenerational bonding with our older persons. Are you satisfied with your intergenerational bonding? Because anyone, even you, me, everyone, we will become one day an older person. So from the beginning, we should know where we are stand for. And already those who have entered into the old age, this is also common for them. And those who are waiting for this situation, then for them also it's very common. So are you satisfied with your intergenerational bonding? If not, why? And what we can do? And what is your take-home messages? So very brief presentation, but I thought to share my views based on practical aspects of this issue. So intergenerational solidarity, it's a strong and a close bonding between two or more generations, and it's a fundamental of the achievement of the society for all ages. But when we are talking about this current situation, we know a lot of globalization, migration, and a lot of issues are happening. So because of that, we know that our intergenerational bonding, we have a very big gap in that. So what happened to us, why we are having this gap, and what we can do? That is the question and the answers what we need to focus. Actually, intergenerational solidarity become more complex. So that is a point that we always need to think, what has happened. So with that, why it is important, the intergenerational gap are widening due to the fast, as I already mentioned, changing of lifestyle, globalization, migration. So due to this widening intergenerational gap, many negative outcomes have appeared. What are those negative outcomes that we are encountering today? So I think with this COVID-19 pandemic, we have all of us, where we are in the world, we have all experienced the negative aspects of this intergenerational gap widening. So what are the things that happen to us actually? So with this intergenerational gap, sometimes we misunderstand each other. Sometimes our flexibility, we lose that. Sometimes due to these lifestyle changes and then the environmental negativeness, all these things makes us health impact. So we all know with aging, there are a lot of implications happening. It could be health, it could be social, it could be financial. So all these implications made worsen because of this intergenerational gaps. So those are the main negative things which happens to us. So then we need to think very innovatively how we can minimize this gap. And apart from this, at a glance, we see this gap. At a glance, we experience this negative aspects, but there are certain associations as well. So we need to think of those associations, or we need to think of those hidden factors as well, because all these things will affect to our health and quality of life of our older persons. And not only the older persons, when we take as a whole family, everybody in the family will affect from those things. It may not be visible, but there are a lot of things. I think this is a very important thing we need to clarify, or we need to think very analytically, situationally analysis we need to do in an in-depth manner. So when it comes to the Sri Lankan scenario, we Sri Lanka is an island, as all of you know. So we have very limited population, 22 million. So out of that, 15% out of our total population, more than 15% are elderly. And of that elderly population, as similar to the other countries, more females are there. So because of their life expectancy is more, and then because of that, widow population has gone up. So with all these things, we have identified, apart from that, as I mentioned earlier, there are a lot of implications happening in social, health, and financial. So when it comes to all three implications, one of the key factors is the widening gap of intergenerational bonding. So we need to think what has happened to us. So, so this is the widening or the negative impacts we just encounter. Those are the things we see, or those are the things we feel. But under that, there are a lot of positive factors. We need to explore those things. It may be changing of our values and attitudes. So we all know that our younger generations, their values and attitudes, it's not to Sri Lanka, it's not to India, it's not only to Nepal or some other country, it's worldwide, it's happening. So changing of values and attitudes. And there are a lot of globalization happening, and people are migrating either from the village to the town, or from to another country. So the migration. So our elderly population, sometimes because of their younger, either sons, daughters, or grandchildren, their family, because of this migration, the isolation is a big problem. Even WHO has identified the isolation among older persons has become a public health issue. So it's another issue that it's another positive associated factor with intergenerational widening of this gap. And also the time factor. So we need to think of what is this time factor? What has happened to us? Because as a life cycle, when we are going through the life course approach, time to time, we are facing different challenges. Time to time, we are facing different issues, and how we have to think of overcoming this as a collective effort. Are we using our maximum effort for that? So the time factor is also another hidden associated factor. And also the COVID pandemic, we have all encountered this. Financial matters, property issues, social issues, all these are other associated factors under these C. What we see, but the bottom part we are not seeing very much. Though we are seeing it, we are not very much keen on this. So it's time for us to also digital technology, and especially for our younger people now, they're addicted to that. Because of that, they are not talking to their elderly people. They are not in the family group. With the relationships are very much disturbed. So those things are also happen. And the competition, way of living, competition, the desires are more, and their lifestyle is sometimes they are not very appropriate, the lifestyle. That's why we have to think of the demographic changes, as well as it's going hand in hand, this epidemiological transitions. The NCDs are more, so their active lifestyle has gone down. So all these matters are associated factors with this intergenerational bonding issue. So then we have come across in 4 generations plus the and why is it, and all sorts of letters are there. So with that, we need to think what has happened to there. We have already talked about the values and all these other attitudes and all those things. So in these 4 generations, or this especially 5 generations, what has happened? So we need to think of that part as well. Sometimes these things, the practical aspects, sometimes they are fashion. Very simple as an example, they are fashion. The way they wear their dresses, the way they talk, sometimes it's not appropriate to our elders. But we have to identify the gap first. Accordingly, then we have to change our reaction. So that's the message that we need to identify. And also, so the actions, what we can do. So the first action, what we need to think is advocacy and awareness, especially for both generations, the younger generations. I mean, the younger generations, not only the adolescents and the adults, there are income generation with other groups as well, especially when you take a family, mother, father, children are there, the grandmother, grandfather is there. So all of them, they need advocacy and awareness, not only one group. That's another key message that we need to, it's a very important message. Everybody needs advocacy and awareness, because if we advocate one group, it won't be a success for the other one, and then the whole system will get collapsed. So we need to advocate and awareness on healthy aging, how we can be a healthy, active, healthy aging, especially because everyone will become an elder one day. So that message should go. Then they have to be how they need to maintain their bonding, intergenerational bonding. Those key messages we have to give to the society in a practical way. And the other thing is early planning of age life or a retired life. That is what we have seen even in Sri Lanka. Lot of people are waiting until they become elder, until they enter into the elderly life. So no, we need to plan our elderly life very early. Then only you have a focus, you know where you are going, you know what are the issues or the challenges that might come to you or us. Then only you are get prepared for that. So early plan, that's another message that we need to think of. So when you're planning those things, we always try to maintain the dignity of elderly, and also how they are how they socially participate, and then their isolation problem automatically washed off. So those are things it may be a minute thing at a glance when you see this, but it gives a big impact for us. And also be a resource to the younger generation, identify their demarcations. Otherwise, the main thing is a lot of elderly, even everywhere, all countries. Majority of our elderly people are a resource group to our younger generation, but sometimes they have forgotten the demarcations, where the limit is. So if you don't identify that part, sometimes even in my country, the older people are, they are doing without any limits. Sometimes they will become some groups. I'm not telling everybody is doing that, but some people think that older people are just like doing certain things, just like servants like. So if the older persons, when we are planning our retired life or the age life, we need to identify our demarcations, our limits, where our pathway is focused, how we are going towards the active, healthy life. And also, when we are thinking of intergenerational programs, because we all are geared to do a lot of programs, either government sector or the private sector or governmental organizations. We all are geared to do a lot of things, but sometimes we say certain programs are not sustainable. Why? Because we are not thinking of the sustainability, and we are not thinking of integrating into the existing system or programs. Unless we do that, those things won't sustain. So intergenerational programs are social vehicles, and all these when we are planning intergenerational programs. So activities too, we need to think, act different ways. You feel, to feel the difference, because then only the sustainability also comes, because we are dealing with two or more than two generations. So we need to feel it, think differently and act differently. Unless it won't sustain. And also there are certain, in my country, we have elderly clubs and day centers where what happens, early morning, most of the elders, they come and then they engage in a lot of activities. And then at the end of the day, evening, they go back to their own homes, their own families. So one thing is the social isolation is not there. Social participation is there. And in the elderly clubs and or the day centers, they engage in a lot of activities, especially with the younger groups. So we have as service providers, what we have done was we have given the opportunities for them to link with the younger generation, not only the adolescents and the youth, but also the income generation groups as well, because the middle-aged people, they are sometimes, when you are talking to them, we found that they are a sandwich group, because they wanted to look after our older persons, but sometimes because of the social issues, financial issues, their working environment, there are a lot of constraints for them to do that. So we help them to do it, and then just we are giving a bridging of these two generations, or we are a carrier for those, or we provide the vehicle only. So then they take it up and they do it. So when we are doing the intergenerational programs, we always think those type of as well. We have to find out where these things are going wrong and then correct the place. And also the different advocacy programs, like not like same thing, but especially when it comes to the values and the attitudes, and when you are dealing with the younger generations, you need to think differently. That's why I always say think, feel, act differently. Competitions or special day celebrations, this was a good example where my country once or twice we had that, especially still it's going on. The special days we catch, either the Mother's Day, Father's Day, everybody is saying we be in the Asians. So we need not to have the special days. We always, so those are the common things. But when there are things happening, we always take that opportunity to do certain things indifferently. So those are the good platforms for us to link those two generations. And then they will carry that habit forever. And this is a one image or the photograph that we have done this. The elders we have identified to the youth clubs, and then the elders, they gave their knowledge and the skills to this younger generation. Actually, we just introduced it. Still, it's going on and on. They are now very good friends, like. So both of them, both groups, they share their own ideas. So we as the service providers, we can initiate at least. So then they will, they don't have a platform. They don't have that initiation power. So we can do it as the service providers. And also loneliness, especially during the COVID-19 in Sri Lanka, we did a Hello project. That was our youth groups. They volunteered, and what they have done was they identified the elderly, those who have especially staying alone at homes, and then they used to give frequent telephone calls, because no one during the lockdown periods, limited this all restricted movements, and they frequently followed them through the telephone calls. So ultimately, these elders, they were waiting till these youth groups are calling them. And that was called the Hello Project. Still it's going on, where now the lockdown periods have over, but still that habit is going on. Just like that, we need to identify where it is necessary, the time period, and then we can initiate those things. And also networking with the youth and the elderly, especially with this elders diary, especially I don't know whether you all can see this. So this is the booklet that we have published. We gave the opportunity for the elders to write how they felt being with the youth, and how they felt, what they have learned, what they have shared with them. And also we gave the same opportunity for the youth to send us how they felt, or what they have learned being with the elders. So both groups have sent, so we have published these things as 2 booklets for others to get the sensitization as well. So the networking, that's why new methods or new advocacy ways we need to think, dealing with 2 generations. And also, this is another important thing, learning new things. So our elders, especially, they say that sometimes, not like developed countries, sometimes in developing countries or middle and low income countries, they always say that now their thinking pattern is a little bit different. Sometimes they say that now we can't learn, now our time has gone, just like negative thoughts are more. So we need to minimize those things and let them learn new technologies. So it's a good platform to link between 2 generations, especially because when you are having these focus group discussions or some survey methods, especially these youth groups are coming out with, they are very, very willing to be with the elderly group or the older persons to share their knowledge or the skills, especially when it comes to IT knowledge. So take that opportunity and learn more new technologies. Those things we need to advocate. My take-home messages are: plan your age life early. That is the very important first message that I am going to give. And for the elders, be flexible and be with your family, be a resource to your younger generation, and maintain your dignity and identify your demarcations. And learn new technology, especially the digital inclusion, bridges generational gap, and explore new opportunities and existing services for you. That's another important area that most of our older persons, they are not aware of. They are unaware of the existing services for them. Especially we have encountered this issue during the COVID situation, where they are confined to their own homes. So there are a lot of services, but our people are not aware of those things. So these messages are very much important with this COVID pandemic as well. For the younger generation, respect your elders and think, feel, act differently. So we, as the service providers or the elders, in the adults in the society, we have also a duty or a role to play to make them aware how to think, feel, act differently towards elderly, and maintain bonding of your older persons, because otherwise we won't be able to combat ageism. So we have to empower them as well, and be active for combating ageism. Do not forget that everyone be an elder one day, because this is a very important message for our income generation group, because they are in a very competitive world. Their lifestyle is changed. They have very limited time factor for work and and maintain their relationship with older persons. But we have to give that message as well, because the generations, to minimize the gap, we need to think differently, act differently, feel differently. Thank you very much.
Thanks a lot, Shirami, for that lovely presentation and the advantages of intergenerational bonding and how to cover gaps in our lifestyle, and especially in this world of globalization, and what negative things can happen and how misunderstanding and lack of flexibility can happen because of lack of intergenerational gap, and all the quality of our life can change, and how important it is to sustain advocacy and awareness across generations for that intergenerational bonding to be maintained and kept. Thank you so much, Shirami. Really enjoyed the presentation. And now I would request Dr. Itisham Khalid to be our next speaker. Dr. Itisham Khalid is a consultant neurophysician at Ideal Medicare, Multan, Pakistan. He has done his MBBS from Nishtar Medical University, MRCP from UK, FCPS Neurology from Pakistan. He's a diplomat of American Board of Neurology, diplomat, American Board of Neuromuscular Medicine, diplomat, American Board of Quality Assurance and Utilization Review for Physicians. Dr. Khalid has presented his research nationally and internationally on multiple platforms. He is the current neuromuscular section chair for Pakistan Society of Neurology. His interests include genetics and autonomic disorders in neuromuscular medicine. I would like to invite Dr. Khalid for his presentation now on health empowerment of the older persons in Pakistan. Over to you, Dr. Khalid.
Thank you very much, Kiran. And I appreciate DWRF and ACAP. Catherine, Mala, and Kiran has very nicely put together this meeting, and I actually had great learning hearing everyone. So I will give my perspective as a clinician, as you can see from my first slide, about health empowerment of the elderly in the Pakistan and how we have managed during the time of COVID. My first slide is from the Holy Prophet, peace be upon him. One who pleases his parents has verily pleased Allah, and one who has angered his parents has verily angered Allah. And starting by this slide means that I think we all need to understand the socio-religious background based on the geographical location and the society we are dealing with. And it was great to hear everyone from their perspective. So as a clinician, when I see a patient in the clinic, what we usually do is the physical assessment of the patient, making sure what's going on in terms of their medical problem. But what I realized after coming back to Pakistan is I also need to look into the other factors, which were the psychological and the spiritual factor of especially elderly population. There are a lot of initiatives taken by the government in the past few years, but there was still a gap. And after listening to today's presenter, I actually learned many new things, and I think I would like to implement those in future. So what I like to do is not only assess a patient clinically or know what's going on from the pathological perspective, I also try to look into their psychodynamics at home as well. If there is any stress factor, is there something which is bothering them beside the disease, which is a pathological process and can be corrected with medication? Also, what I try to touch upon is the spiritual factor, because as a whole, as a human being, we need to address all these factors to make one complete human being addressing or interacting with the environment around them. So most important part is the issue of the aging population. What I try to talk to them about is understanding the concept of normal versus pathological aging. And what I try to communicate is not only to the patient, but also to their family, to make them understand, is it really pathological? If it's a behavioral issue, which can be addressed with the medicine, there is something which is affecting their psychological well-being at home. So addressing that factor, it could be just not having a stair to go one level up, or not having a proper other maneuvers to walk around or be independent. What I also try to communicate to them is about the neurological decline, which comes with aging. Sometimes we become indifferent about what's gonna happen with the age. If there's gonna be a neurological decline in terms of calculation, monetary issues, just we talk about making phone calls, or there could be neuromuscular decline in terms of the physical capability to do certain chores. If they are not able to perform the routine stuff at home, how they can manage, do they need to have some help, and how they can arrange that help at home. The other very important factor which I try to communicate to my elderly patient population is about invisible second patient, which is a very important concept for the society as a whole, and especially for the elderly population who are running into dementia and other neurological problems, because most of the time, the invisible second patient is the spouse. And usually in our society, because it's a family-based system here, and most of the time it's the wife who is a couple of years younger than the patient, and she is actually the invisible second patient because she is probably suffering more because of the patient condition. So what I try to communicate to the kids or the children in the family or the family members, that they also not only take care of the patient, but also of the spouse of the patient or the mother as well. The society attributes in Pakistan, we also try to communicate to the patients in the clinic about the capacity of decision making. It not only involves the simple decisions about what to wear, what to eat, but also about making bigger decisions which could be life-changing. Because of the combined family system in Pakistan, the elderly people are usually considered to be virtual head of the family. They may not be making the final decision, but they actually considered to be part of most of decisions, which is good to keep them involved, and they also feel more involved with the family decisions. Also, there could be socially, they are, as I said, considered to be very much involved in the family matters, which is important. And also it gives them the autonomy and authority in the family as well. Religiously, as just I elaborated in my first slide, they are given very prime importance, but naturally there are other incidences, or I'm going to talk about few, where the patients have to move out of the family, or the elderly population are not taken care of as much as they should. So they are neglected. In that case, there has to be some legal help. And as a matter of fact, the government of Pakistan has recently passed a law as well, where the kids or the children in the family cannot move the parents out of the house. And in case they do, they have to arrange a new house for them and to support them from the monetary perspective. And if they don't, then there are legal repercussions to that. There are naturally limitations to every society and every system. But what I try to do, and what I have been trying to implement in my patient population, is to make them understand the pathophysiology of the disease. Naturally, it takes time to sit with them in the clinic and to guide them about the pathological process. It could be dementia, it could be Parkinson's disease, it could be their other chronic medical problems. Due to limited health resources, this is somewhat lacking, that the doctors give less time in the clinic. But I think this is one way to bring a change in their life, to communicate, let them know how they can improve small things to make their life better, especially when they have elderly at home and they have to go to job, because I know some cases where the kids have to quit their job or they were doing job from home because they were not able to arrange someone to take care of the elderly at home. The other limitation is about lack of education. The literacy rate in Pakistan is 62%, but a good number of population of patients is one who can just write down their names or few sentences, and they are not educated to the point that they can understand the medical stuff. So it's hard for them to understand when you just say that they need a speech therapist or occupational therapist. You have to guide them about what does that mean. The other important part is about falls and fractures because of lack of education and poor nutritional status of population in general, because it's a developing country. I think that is another big limiting factor which affects their ability and the well-being as a whole. The other part is the unhealthy lifestyle, which means that there are not enough open spaces. There is lack of interaction. There could be poor social support or poor monetary support, resulting in poor nutrition, and general well-being in general is affected. So what has been done recently, because there have been some initiatives by the government. So they did a study and they noticed that 72.4% of the geriatric population seek medical advice at the private hospital, which is naturally expensive and it comes at a high cost. So the government recently has taken the initiative to start the health card. So the head of the family actually has that sum in their card where they can use for their healthcare. They can go to any private or government hospital of their liking. And we hope with that, there's going to be change in the healthcare, especially for the elderly, because they will feel more in control. The other numbers in this slide are basically international numbers taken from US, because there were not enough studies in Pakistan. But I think these numbers can be reciprocated in some way in Pakistan as well, because what has been noticed in those studies was the caregivers are 65% females, which I have just mentioned is kind of similar scenario, because those are usually a couple of years younger than the male spouse, and they are the main caregiver or taking the burden of the elderly patient who is actually sick. 21% are 65-year-old or above. 40% of the spouses have college degree, which I feel in Pakistan, this is going to be a much smaller number because the literacy rate is not as much as what we see in developed countries. And 71% of these patients were married or in the long-term relationship, which I think is a good part of the combined family system or the married life, because that helps the spouse to understand the need and to communicate better because they have been together for a longer period of time. So in terms of empowerment of the elderly, I think what has been done or what I have been trying in my practice is communication and communication, because I think that is the key, whether it is the communication to the patient or to the spouse or to the rest of the family members. What I also try to communicate is about understanding the psychosocial dynamics or understanding the stress factors of the family, trying to communicate and give them some ideas to improve it. And I think also the family need to understand the limitations, because if they will not understand the limitations, they will not be able to address it. So what I do is put the limitations in front of them after discussion with them and make them understand how they can come around it. The other big part is in terms of the education. Naturally, I saw some slides in terms of the education of the elderly. There are evening schools which provide education for the elderly as well. And as I said, the Prime Minister recently took initiative about the nursing homes are lacking. So they have started something called shelters, Those are open to everyone, females and males, elderly as well. And in a recent study where there were more than 5,000 people, elderly population were actually observed or studied, and they noticed that most of the people opted to move out of the house or from the family because of the lack of social, psychological, and monetary support. So I think what needs to be done is already in the pipeline, is happening, but things are slow, and I hope things will be improving with the passage of time. But due to COVID, as everything is slowed down internationally, it's kind of a similar scenario in Pakistan as well. I also tried to communicate about the social interaction of these patients. These panaga or shelter homes are also one way to do social interaction. In terms of the COVID measures, those are not very strongly followed, as you can see from the photograph, but I think that is one way that people interact. Also, the telephonic communication is other, which is basically taken by people who are able to use phones. As a physician, I think I have a role to play in the society and community, especially during this hard time of COVID. And actually, we started some other initiatives in terms of how to communicate this idea to other people. This is my clinic data. I have seen in the past 3 years, I came back to Pakistan, more than 3,000 patients, and more than 60%, more than 60-year-old patients were close to 550, which is about 1/6 of the patients I have seen. Almost 80 patients had dementia, 60 had Parkinson's disease, and dementia can be associated with that. The population of my hometown is close to 2 million, and I feel based on 10 other neurophysicians working in the town, there is a ratio of 1 elderly patient with dementia in a population of 1 to 1,000. We have started the YouTube channel where we did lectures, because I think media has a great role to play in terms of social isolation and education of the elderly. In the present time, many people use cell phone. I feel almost everybody carries a cell phone with them, and most of the cell phones have the capability to use YouTube. And we did a couple of lectures, and there was a great response from the family and also from the patient in terms of their learning how to manage things, how they can do some exercises at home to prevent falls. But at governmental level, there are some activities, but I think there is more need to be done at personal level and as a group as well. I really appreciate, again, at the end, to DWRF and ACAP. My email address is there if there are any questions. And it was a great discussion so far. Thank you so much, everyone.
Thank you, Dr. Khalid, and explaining us the understanding normal versus pathological aging and how things can change with neurological decline and cause psychological problems, how people can arrange for health and help regarding dementia and Parkinson's diseases, and how life-changing decisions are important, and how the government is helping out by creating new shelter homes where you've seen almost 5,000 people, and the knowledge of people who are stepping out of the family and going to these care resources is quite wonderful. I think that is the most modern trend, because that doesn't hurt the dignity of a person. Thank you so much, Dr. Khalid, for sparing your time and joining us, and for your lovely presentations. Now it's time for question answers, but I think if you look at the chat, there are hardly anything in the chat. There is Dr. Balambai raising her hand, so maybe she has a question. So we will just take about a little time answering her question. Yes, Dr. Balambai. Yes.
You need to unmute so we can hear you.
Yes. Yeah.
Sorry, thank you. Very good morning to everybody. I'm very happy to be a part of this program. Though I am an elder person, though I have been member of very many associations and all, in this program, I'm able to learn something more also. And I would like to have two questions. One is for Shiromi and for Khalid, Dr. Khalid. So for Shiromi, I would like to tell that how is it possible you think that we elders could be of resource to the youngsters, one thing. Because do they have time to listen to us? That's one thing I feel. There are some good children, good grandchildren who are able to listen to us. But how many of them are ready to take lessons from us or information from us, or we are resource to them? I doubt. And more so, you see that we have the Elders' Day celebration on October 1st every year, our organization, our association. But how many youngsters associations celebrate this program? Think about it. So are they interested in these things? Or they have other priorities? That's one thing. And my question to Mr. Dr. Khalid, wonderful speech you gave. But at the same time, I also read Quran, and there how it is stated, one who pleases the parents pleases Allah. Very correct. But why there are so many old age organization associations today? Old age homes. If everyone, every Muslim, or even in Hinduism, Gita says so many things are there, same principles are there in both the religions. But how many follow this? Why the elders suffer? The Nepal lady was telling, Sanju was telling a lot about the elderly people. There also you find only women learners are more than men. You find that. When she gave the statistics, I was really surprised. Men are not interested in learning, even at the age of 70, 80, 90 and all, whereas women are interested there. Thank you so much. And I'll be happy to get an answer from the two speakers.
Thank you very much for raising this issue. And actually, I'm really happy because this is another point that all our programs initiated. So I think it's a good start to the others also to think. Actually, when we are starting these intergenerational programs, we also encounter the same thing. How many people are listening to the elders? How many are not getting any resource from the, that how many are not getting the advantage of having this precious resource in the society. So then only we understood, then we had some focus group discussions on both groups, elderly as well as the younger groups. Then only we identified how we should do this. Because in general, we think that young people are not listening to us except one or two, even our one or two grandchildren, not even sometimes our grandchildren. But when you are starting with that, there are a lot of people gather around you. So that's the experience that we have gathered. That's what the good practice that we want to share with you as well. So when you are starting with not just same thing what we are thinking of, that's why we always think differently, act differently, the way they grab things. So we need to be a little bit more innovative. So they are the service providers and all these program managers. They need to think how we are planning the innovative programs for elders to be linked to the younger groups. Because always in general, we think that youth people or the adolescent, youngers are not listened to the elderly. But no, it's not like that. But if you start it, it will happen. So, but the thing is, the start should be very innovative, culture-specific innovative things. But sometimes the novelty should be there. Then, so very basic example. So in my country, there are traditional way of making some handcraft. So then at a glance, I mean that when we were talking about those things, how we should transfer this knowledge to our younger people. So first impression what we got from our elderly people was, no, they are in another world. They are with their phones. They are with their video film. No, we can't give this. But when we touched our younger people, they said, okay, we are happy to have that, but in a digitalized way, how we can do it in a proper way. So we thought, we then consulted our IT fellows or the experts, and then we thought we brought them to the platform, and then we correct them in a novel way. We can't do exactly 100% things, but to a certain degree, if we start it, then it persists. So that is the experience that we have got. But actually, I'm really happy to raise this question from you, because that's the same scenario we also experienced when we are starting this. Thank you.
Thank you.
Okay, Dr. Khalid will also answer that, but we are running over time already. So I would request the other participants to email their questions to the speakers for proper detailed answers. So we will just wait for Dr. Khalid to answer that. And I would like the speakers that they can share their email with all the participants. They can put their email on chat so that people can ask them questions even after that. Yes, because it's an international webinar and lots of people are getting late, So it's already, so Dr. Khalid, continue. Yes, please answer that question.
Thank you so much. I love that question. I am religious, but I don't have that much of religious knowledge to give a religious perspective to that. But I will give you as a common society person, as a clinician, I'll give you my perspective. So I just give an example. This is what I tell my patients actually, that if there are 3 kids or 3 daughters in a family, and like in a combined family system, females usually cook. So I tell them that those 3 girls gonna cook the same dish, and the taste for that dish gonna be different for all 3 of them. Despite the same fact it's the same dish, 3 girls from same parents. So from what I kind of learned is that all religions are beautiful. So what we need to understand is that you can implement one's experience to other. Everybody is different. Even it may be the most pious parents, the kid may have different attitude and different learning. So that's why it's kind of, I feel the same way in Pakistan, despite the fact there is a lot of religious perspective to parents. They are given very prime importance in the religion of Islam. But yes, I agree, not everyone follows the same way. But I don't have the true religious verbiage to that. That is more of my social interaction and what I have learned. But it was a great question, and I agree with you. And I believe it's in every society. We cannot just put it down to Pakistan only or to one religion only. I think it's a kind of a global phenomena. And again, in that global phenomena, media plays a great role and modifies and refine the thinking and of the next generation. So that's why we call them millennials or X generation or whatever. But I think there's a lot of environmental, social influences beside the religious background. So I think that all makes one a total human being. That's why I put down 3 things: physical, psychological, and spiritual, because I believe all 3 plays part, not one.
Yes, thank you, Dr. Khalid. Yes, and now I will request Dr. Mala Kapoor Shankardas for giving her closing comments. Over to you, Mala.
Thank you, Kiran. You would agree with me that this has been a wonderful webinar because of the immense information it provided and bringing so many of us together from different parts of Asia Pacific, as well as from few other countries. It would be nice if all participants stay in touch with ACAP and DOF, Development, Welfare and Research Foundation. The presentations and also comments in the chat box have provided specific insights on empowerment strategies, which are necessary for governments, civil society members, and all individuals concerned about aging, and they must adopt these. Empowerment is not just something which can just be given to people. It is an experience which aging people must undergo. It is the power for them to realize the need for improving their life. It is a feeling that their voices are important for society and they must express it. It is a desire to manage their lives themselves, to get involved with activities that can improve their lives. Various international instruments initiated by United Nations and member states over the years, and especially through the Madrid International Plan of Action on Aging, set goals for empowering older people. I'm glad to note work on this is going on in many countries, and today we had few illustrations on what is happening at the grassroots levels. I would request participants to share through email their programs so that at some stage we can compile it all. You have contact details of ACAP and at Development Welfare and Research Foundation. We would be happy to hear from you. You can get in touch with Catherine, Kiran, and me. I provided my NGO address, email. Catherine has provided her email in the chat box, and the speakers have provided their email in the chat box. We all have to work together, especially as all our countries are striving to achieve the 2030 agenda of SDGs, the Sustainable Development Goals, which clearly emphasizes on leaving no one behind. Thus, we all have to make attempts to have older people included in all plans, policies, and programs which impact quality of life issues. We at DOF are especially concerned with improving quality of life issues for people as they age by taking little initiatives which are meaningful, purposeful, and impact successfully. This is also what ACAP strives for, and thus happy to work together in the areas of health, literacy, which can be in terms of education, financial literacy, digital literacy, legal literacy, and covering various aspects of social sectors. We need to touch the lives of most vulnerable in the vulnerable group of older people and totally empower them to be part of the development of their respective countries. Empower them to be an important resource which cannot be overlooked and have their rights denied. Thanks to each one of you, and especially to panelists who on my asking gave their valuable time. Appreciate everybody's contribution, and once again request you to stay in touch from all parts of the world. Thank you all for this wonderful webinar once again. So with that, we close the meeting, and I would like to say bye-bye, and so would other presenters and coordinators.
Thank you so much.
Thank you,
Thank
everybody.
you, Mala, and thank you, everybody, and all the contributors. Yes, Catherine.
Thank you so much.
Sham, Sanju, Shiromi, Malambai.
Yeah, thank you.
Everybody,
Thank you.
everybody. It was lovely. And I think the webinar was a great success.
Thank you.
I agree.
I love to listen to the presentations of everybody. They were really outstanding. Thank you so much for having spent that time. Bye. Thank you.
Thanks, everybody.
Thank you so much.
Bye. Bye.
Bye. Bye. Bye.
Bye.
Bye.
Bye.
Bye.
Yeah.
Thank you, Catherine.
Thanks again.
Catherine,
it was lovely.
It was wonderful, your support.
Very nicely done.
Thank you, Mala.
Bye. Bye.
Bye.
Ma'am, Robin here. Good show. See ya. Bye-bye.
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 Bye-bye. Very good. Bye, Tree Booty. Good to see you. Take care.
Bye.